serious apologies for the technical difficulties that I was dealing with, but hopefully we've got things fixed and we'll be able to get through this. Let me begin by saying that I appreciate you taking time to meet with me. We decided to convey this message to all of you in the interest of transparency. The first thing I want you to know is that we are open for business, number one. Number two is that if anybody perceives that they have an emergency or that an emergency has been identified for which emergency department care is necessary, absolutely come. Our doors are open. Our physicians, our nurses, other ancillary personnel are dedicated to taking care of people who walk through those doors 24/7, 365. We also understand that sometimes people will present to the emergency department with conditions that may not be emergent, that perhaps they could be cared for in a different site. We strongly believe about right care, right time, and right site. It's important always to confer with your physician, and perhaps the condition or symptoms for which one has can be dealt with in the physician's office, perhaps in an urgent care center. We have a number of community resources, not the least of which are our own immediate care clinics, virtual care clinics, our primary care clinics, notwithstanding those who need the emergency department. As you have been informed, our emergency room has been extremely busy. It's not uncommon to see high volumes this time of year. The issues with delayed or long wait times in the emergency room are compounded by the fact that we are at capacity within our inpatient facility. We are treating numbers of patients. Beds are full. We're using stretch ratios in some cases with some of our nurses. And that delays the efficiency with which those who need admission from the ED can get a bed in the hospital. Because of that, then there is some backup in the emergency room, but we want people to know that everybody who walks through those doors or is brought through our 4 doors to the ED undergo a triage process. Those with the most serious conditions or symptoms will be prioritized, meaning those who have less serious conditions or symptoms may have to wait a little bit longer than usual. As I said, we're blessed with a wonderful medical community. There are resources outside the emergency departments. And again, as I said, we offer immediate care clinics, virtual care clinics, and also our primary care clinics. And we would always encourage individuals to consult with their physicians or other care providers when they're feeling ill and wish to seek urgent or immediate care. So with that, I'm happy to open it up to questions that you all may have.
First one that came in from Julie Anderson. I expected this is one we would see. Can you characterize how long the waits may be in some of these cases?
I can't provide an exact number. Those numbers are dynamic and they may fluctuate during different times of the day. And there may be times when one actually can be seen, in a rather quick manner. In general, however, we've been seeing people with the less urgent conditions having to wait longer than average. And again, as I said, those numbers are dynamic.
Again, Dr. Frankel's available for just a couple more minutes if anybody else has any questions that they want to pop through in chat. One of them that I've heard come up, Dr. Frankel, what are some of the things that are contributing to this?
Yeah, so not the least of which is that, as I said, our hospital is at capacity, and we have a number of patients who are ready for discharge, but are difficult to discharge for a variety of reasons. We know that those who need post-acute care, so need to go to a facility once they've completed their acute care journey with us, that those facilities also face the same issues that we are facing as an acute care hospital. There are workforce shortages in the post-acute facilities. There are certain conditions that some of these post-acute facilities choose not to accept because they don't have the expertise to care for those conditions. And so we know that the post-acute beds are tight, just like the acute care beds in our community. There are guardianship issues at times that prevent the expeditious discharge of patients who are otherwise ready for discharge. So it's a complex set of circumstances that prevents the efficient discharge for patients who are ready from necessarily occurring.
What can the community do to help?
Well, as I said, first and foremost, if you perceive an emergency condition or one has been identified by somebody else on your behalf, get to the emergency room. And we would, if you need to come to our emergency room, we want you to come to our emergency room. Our doors are open. As I said, our care teams are committed to taking care of you 24/7. If, however, there is the opportunity to seek care at an alternative site where your symptoms or condition can be appropriately cared for, we would encourage that. And as I said, anytime you have the opportunity to reach out to your physician and consult with your physician and get that advice as to where you would best be served, we think that is most appropriate. They may say, we'll see you in the office. They may say, go to an urgent care center. But as I said, our community has a wealth of resources in this regard, and not the least of which are our own immediate care clinics, our virtual care clinics, et cetera. And so we would implore you to use those appropriate sites of care when it is reasonable. Again, however, we are not telling people not to come to the emergency department if in fact there's a perceived or identified emergency condition or set of symptoms, because we want you to get the timely necessary care that is appropriate to your condition in a fashion that you would otherwise expect, and we're here to deliver that.
Okay, I told Dr. Frankel I would release him by 3:45. So this is last call. If anybody has any questions, go ahead and pop them in chat really quickly. Otherwise, we will go ahead and wrap up. For those of you who have asked about a recording, we will go ahead and upload this. From Alexandra, you mentioned those post-acute care facilities seeing worker shortages. Is Nebraska Med also seeing those shortages? And this will be the last question. Thank you.
Yeah, it's a good question. The workforce shortages in healthcare are not unique to post-acute facilities, to Nebraska Medicine. This is a nationwide problem that we in healthcare in general are all facing. We are doing our best through a variety of means, using contract labor, traveling nurses, et cetera, to fill the gaps that we have. But the system is stretched right now nationwide. And so it is a problem that we are all dealing with, regardless of the level of care, facility, and or clinics that you operate. We will continue to manage through this as best we can and as the workforce supply permits.
Thank you, Dr. Frankel. Still 3:45, so we did it. Thank you very much for your
much.
time. We appreciate it.
You bet.
Again, as I was saying, for those of you who are looking for a recording, we will go ahead and upload the entire presentation to our YouTube channel. We'll have it up here within probably about 30 minutes or so. If you do not see it on the Nebraska Medical Center YouTube channel, shoot me a note or an email, and I'll make sure to get you the link. So thank you for your patience in getting started a little bit late, and we appreciate your time. Have a great afternoon.